Hello, everyone. My name is Esther DeVito, and I'm an autistic advocate and psychology student at George Fox University. As many of you know, I boldly share my story, and I'm excited to get into the research aspect of that today. Today, I'll be presenting on autism spectrum disorder, commonly referred to as ASD. Autism is a lifelong neurodevelopmental condition that influences how a person perceives the world, communicates, and connects with others. As both a researcher and an autistic woman, I find it deeply meaningful to discuss autism from both the scientific and lived experience perspectives. My goal today is to highlight what the research says, what current data show, and why a neurodiversity affirming approach is essential to supporting autistic people throughout the lifespan. According to the DSM-5-TR, autism spectrum disorder falls under the category of neurodevelopmental disorders. It is characterized by persistent difficulties in social communication and social interaction, alongside restrictive and repetitive behaviors, interests, or activities. American Psychiatric Association, 2022. Symptoms typically appear early in childhood and cause challenges across multiple settings. The DSM-5-TR also emphasizes that autism is a spectrum, meaning that the way it manifests differs significantly from person to person. Some autistic people may have significant support needs, while others live independently and excel in their chosen fields. Brindley and Deffen remind us that while autism includes impairments in social reciprocity and flexibility, these differences also reflect diverse neurological functioning rather than pathology. As an autistic woman, I appreciate that current frameworks are moving away from deficit-based language and toward acceptance-based models that recognize both strengths and challenges. Autism is far more common than once believed. The Centers for Disease Control and Prevention reported in 2025 that approximately 1 in 31 8-year-olds in the U.S. is identified with ASD. This increase from previous decades reflects improvements in awareness, screening, and diagnostic criteria rather than a surge in cases. Autism occurs across all racial, ethnic, and socioeconomic groups, but disparities remain significant. For instance, girls and women are still less likely to be diagnosed, often because they present differently or mask their traits to fit social norms. I can relate to this personally, as my own diagnosis came later in life after years of masking behaviors that allowed me to appear socially typical, but led to chronic exhaustion and burnout. Understanding these patterns helps clinicians recognize autism and those who may have been overlooked in the past. Autism has a strong genetic basis with heritability estimates ranging from 60 to 90%. Environmental factors such as advanced parental age, prematurity, and low birth weight may also contribute modestly to risk. Co-occurring conditions like ADHD, anxiety, depression, epilepsy, and gastrointestinal difficulties are common among autistic individuals. Mental health challenges, particularly depression and suicidality, are of grave concern. O'Halloran found that autistic people are 3 times more likely to experience suicidal ideation than non-autistic peers. As an autistic woman, I understand how chronic social misunderstandings, sensory overload, and societal stigma can contribute to emotional distress. Autistic individuals need access to neurodiversity affirming mental health supports. These mental health supports should be delivered through a trauma-informed, sensory-aware lens. One of the most striking and personally resonant concepts I've learned is called masking or camouflaging. Masking refers to consciously suppressing or hiding autistic traits to appear more socially typical. This behavior is pervasive among autistic women and girls who may mimic peers or force eye contact to avoid judgment. This is something I thought that all people did. When I started noticing that I would count how many seconds I would hold eye contact with someone, that was a red flag, and it pointed me to asking deeper questions about myself. While masking can temporarily help a person blend in, it often comes at a cost: emotional exhaustion, anxiety, and identity confusion. Ridley and Daffin note that chronic masking is linked to increased depression and even suicidal ideation. I personally relate to this, as years of masking during school and early adulthood left me disconnected from my authentic self. Recognizing the toll of masking helps professionals and families understand that acceptance and authenticity are vital components of mental health. Beyond mental health, research increasingly shows that many autistic individuals experience chronic physical conditions at higher rates than the general population. These include disorders involving the connective tissue, autonomic nervous system, and immune response, such as hypermobile Ehlers-Danlos syndrome, also known as HEADS, postural orthostatic tachycardia syndrome, also known as POTS, and mast cell activation syndrome, also known as MCAS. HEADS involves joint hypermobility and connective tissue fragility, often leading to chronic pain, fatigue, and injuries. POTS affects the body's ability to regulate heart rate and blood pressure, causing dizziness or fainting upon standing. MCAS results from overactive mast cells, triggering allergic type reactions, flushing, or inflammation. Researchers have observed that these conditions, sometimes referred to collectively as autonomic and connective tissue dysregulation syndromes, appear disproportionately among autistic women. While the exact mechanisms remain unclear, hypotheses include genetic overlap, collagen structure differences, and immune dysregulation that interact with neurodevelopmental pathways. From my own perspective, this area of research deeply resonates. Like many autistic women, I've experienced unexplained pain, fatigue, and allergic type reactions since childhood. For years, these symptoms were dismissed as anxiety. Only recently have scientists begun to validate the physiological basis behind them. Recognizing these overlaps changes how we understand autism, not only as a cognitive difference, but as something that can intersect with the body's systems in complex ways. It also reminds clinicians that autism-informed care must be multidisciplinary, addressing physical health, nervous system regulation, and sensory needs together. There's no single treatment for autism, but there are many effective evidence-based supports. The AAP recommends early interventions such as speech and occupational therapy and parent-mediated programs like NDBIs. I personally value these therapies that promote connection and independence over compliance, meeting people where they are. Current research is becoming more inclusive and participatory, with autistic voices contributing to study design and interpretation. Recent CDC surveillance continues to refine prevalence data, highlighting early diagnosis as a key determinant of positive outcomes. New studies on NDBIs demonstrate measurable gains in language, play, and social engagement, even when delivered via telehealth. Research on camouflaging and suicide prevention continues to expand, emphasizing the psychological toll of masking and the importance of authentic identity development. These studies collectively suggest that improving accessibility to autism-informed mental health care and peer support may reduce long-term distress. I find it inspiring to see more autistic researchers leading this work, ensuring that our lived perspectives inform future interventions. In summary, autism spectrum disorder is a lifelong neurotype, one that shapes identity, learning, and relationships in meaningful ways. It's not something to fix, but something to understand and support. Early identification, individualized intervention, and community acceptance are all essential for helping autistic people thrive. The more we approach autism from a lens of acceptance rather than pathology, the more inclusive and compassionate our systems become. From my perspective, as an autistic woman, embracing authenticity has been transformative. When I stopped masking and began embracing my sensory needs and communication style, I experienced not only relief, but genuine self acceptance. That personal and societal shift from awareness to acceptance is what truly changes lives. Before we move to the final slide, I'd like to leave you with some questions for reflection. How can we, as future clinicians, educators, or professionals, create more neurodiversity affirming environments? What biases might still shape how we interpret autistic behavior, especially when it differs from social norms? And how can we shift from merely being aware of autism to actively building communities where autistic people are valued and included? These are not just theoretical questions, they are ethical and practical challenges that will define how society supports neurodivergent individuals moving forward. These are the sources that informed today's presentation. I encourage you to explore them to deepen your understanding of autism as both a clinical and cultural phenomenon. The DSM-5-TR and Bridley and Daffin's Fundamentals of Psychological Disorders provide foundational knowledge. At the same time, more recent studies by the CDC and contemporary researchers highlight the evolving science of autism and its lived realities.